The President needs to change his policies on many of these fronts. No? Marami tayong hinahanap ng mga reforma. After all, yun naman yung pangako sa taong bayan, di ba? Kung magkakaroon ng mga pagbabago. So hinahanap natin itong mga reformang ito.
At hinahamon natin si Presidente, tigilin na niya ang kanyang kahibangan na destabilisasyon. Tigilin na niya ang kanyang kahibangang pagkopya sa idolo niyang diktador na si Marcos. Magtrabaho naman siya para sa mamamayan, no?
Sa akin dito, among the other crimes that he has committed, sama na yung mass murder, corruption, plunder, lahat-lahat, dagdag pa ito mga ito.
I think there are qualitative similarities between the two. Pero kung bibilangin natin ang numbers, ay mas grabe ang pamahalaan ngayon.
Attorney Jel, may maganda bang nagawa ang Duterte administration?
Yung no smoking.
Sa kalusugan naman po, nang dumating tayo, 62% lamang ng mga Pilipino ang naka-enroll sa PhilHealth. Ang masaklap, hindi pa masiguro kung lahat sila ay kabilang sa mga totoong nangangailangan ng kalinga ng Estado o buenas lang na malapit sa politiko. Ngayon po, 85% ng lahat ng mamamayan membro na nito. Ang ibig pong sabihin, 23.31 milyon na Pilipino ang naidagdag sa mga saklaw ng PhilHealth mula nang bigyan tayo ng mandato. Maganda pa rito ang 5.2 milyon na pinakamahirap na kabahayang tinukoy ng National Household Targeting System, buong buo at walang bayad ng makikinabang sa benepisyo ng PhilHealth. Dahil po sa no balance billing policy ng Department of Health, ang lunas para sa dengue, pneumonia, asthma, katarata, gayon din ang pagpapagamot sa mga catastrophic disease tulad ng breast cancer, prostate cancer at acute leukemia makukuha na ng libre ng mga pinakamahirap nating kababayan. Ito po ang proseso ng pagpapagamot para sa kanila. Papasok ka sa alinmang ospital ng gobyerno, ipapakita mo ang iyong PhilHealth card, magpapagamot ka, at uuwi kang maghinhawa ng walang inilabas ni isang kusing. Sabi nga po sa isa sa mga briefing na dinaluhan natin, 4 sa 10 Pilipino hindi man lamang nakakakita ng health professional sa tanang buhay nila. Sa iba po, mas malaki pa, may nagsasabing 6 sa bawat 10 Pilipino ang puwapanaw ng malayo sa kalinga ng health professional. Anuman ang ating pagbatayan, hindi po may kakailang. Nakakabahala ang bilang ng mga Pilipinong hindi naaabot ng serbisyong pangkalusugan ng pamahalaan.
Universal Health Coverage Act. This seeks to ensure that every Filipino citizen is entitled to healthy living, working and schooling conditions, and access to comprehensive set of health services without financial hardship. This means no balance billing for the non-contributory group members or ward admissions, and fixed co-payment for contributory group members or private room accommodation. UHC is more than just insurance coverage. Thus, it includes both supply-side and demand-side interventions and institutionalizes the updated DOH health financing strategy. Here are the 10 salient features. Simplifying PhilHealth memberships into 2 groups, the contributory or the premium contributions from payroll and others as non-contributory or fully subsidized premium from tax collections. Classifying entitlements into population-based and individual-based healthcare interventions, pooling of all funds intended for individual-based health services together, and designating PhilHealth as a national purchaser for this. Establishing the Health Technology Assessment Council to guide investments of DOH and coverage decisions of PhilHealth. Shifting to provider payment mechanisms with built-in cost containment. Mandating income retention for all government health facilities and submission of clinical costing price data for all healthcare providers. Requiring return service for at least 2 years in an underserved area agreement for all health professional graduates of public universities, ensuring appropriate compensation and incentives for health workers, especially those in GIDA areas. Forming and contracting provincial-based network linked to regional referral hospitals, enforcing share of NBB beds, and rigorous monitoring for quality. registering all primary care providers, and assigning all Filipinos within 3 years of passage of law. Clarifying roles and responsibilities of DOH, PhilHealth, LGUs in organization, financing delivery of health services. Streamlining of PhilHealth Board of Directors with better entry criteria and recognition of corporate structure focused on benefit development and administration instead of membership and collection.
Pirmado na ni Pangulong Rodrigo Duterte ang Universal Healthcare Act. Sa ilalim po ng batas, sakop na ng National Health Insurance Program ang lahat ng Pilipino, miyembro man ng PhilHealth o hindi. Pinalalawak din ito ang PhilHealth coverage para sa libreng consultation fee, laboratory test at iba pang diagnostic services.
Wider access to affordable and quality health care within arm's reach for Filipinos. This is after President Duterte today signed the Universal Health Care Bill. Once enacted into law, the measure would allow for a national health security program that mandates universal health care coverage and benefits for all Filipinos. It aims to achieve 3 objectives: financial risk protection, equitable access to quality hospitals and healthcare facilities, and the attainment of health-related Millennium Development Goals.
Doc, I have a question. What is UHC Act?
Well, basically, the Universal Healthcare Bill is there to ensure that every Filipino is provided healthy living and proper healthcare without extra financial burden.
My second question is, what's the scope of UHC Act?
The common misconception about the UHC bill is that it only pertains to insurance, but the scope that we've tried to cover is both on the supply and the demand of not just the equipment and the materials, but also streamlining and revamping of institutional guidelines that help the patients better be provided with proper and standardized health.
While investments in health have increased over the several years, several policy and operational bottlenecks have constrained universal health care for this country. We shall pool our resources for health services under the Philippines institutionalized primary care as a prerequisite to access higher level of health care and supplement human resource gaps in the LGUs through a national health workforce support system. This will ensure that every Filipino gets the appropriate, affordable, and quality health services in appropriate facilities and will be protected from financial burden due to sickness. To this end, I urge the speedy passage of the Universal Healthcare Bill authored by former Representative Harry Roque. Strong political determination, not political ambition, is the guiding light